we're going to be looking at another snapping hip. Remember, things that go bump in the night. We looked before at the anterior snapping of the hip that was coming primarily from the psoas muscle. Now we're going to look at the snapping hip that happens on the outside of the hip in what we call the lateral compartment of the hip. A lot of people I've had over the years will come up to me and go, I think I'm dislocating my hip, and they do this pop, pop. Do you want to just show us our little hip pop here? So as he sits into that hip, boom, I don't know whether you can see that little gear change, clunk going on there. So a lot of people, I've seen dancers go, look, I can dislocate my hip. If you were dislocating your hip, you'd know about it and you would not be happy. It would be very, very painful. So that's not what's happening. So what is happening? We need to know what the anatomy is in this area to figure out what could be snapping over what. And we've got our lovely friend here that can show us the underlying bones that we have in this area. We have this little round bump on the top of us. This is our thigh bone, the femur. And on the outside edge, we've got this little protrusion. And if you actually sort of sink into your hip and rub your hand down over there, it's kind of down, there you go, yeah. Find that little round knobble. So you can all find that on yourself. This is called the greater trochanter of your femur, if you wish to know such things. But this is where that snapping is typically happening. So what's snapping over it? Now we have a big band down the outside, the side edge of the leg, and most people have heard of this. It's called the iliotibial band, IT band for short. And it's, again, the names sound a little bit complex, but if you know your anatomy, it's just like a map reference to where that tissue is traveling. Your ilium is your pelvic bone. Your tibia is your shin bone down here. So the iliotibial band is going from your ilium to your tibia, okay? So it's crossing the hip joint as it comes down. Now, remember that this is essentially like a long tendon. You could think of it as a long tendon, but it's really a fascial band. And if you don't know what fascia is, go and watch the fascia video. All these videos interconnect, so you've got all those jigsaw pieces to figure out what's going on. But the top end of that band, where it originates, is from two muscles, one of which is called your tensor fascia lata. Tensor fascia might have a clue. It tenses the fascia, right? And it comes off your hip bone at the front here, just to the side of the hip bones. And you were also saying you get a little bit of crunching around that spot too. So this is more of those little clues that are leading us to find our conclusion as to why this is happening. So that's one of the muscles that blends into this iliotibial band. The other is our glute max muscle, so the big muscle around the back here. Those two muscles blend together and they become the long band that then runs all the way down and it attaches to your shin bone at the bottom. Some people get clicking down here. We'll do a different video on that. But here, this is what's kind of clunking around that greater trochanter. So it's typically happening as the leg's coming up and down through what we call flexion and extension. It can kind of do a little gear change as it comes through. Or it might be, as you were demonstrating, that we're kind of sinking into that hip and it's just clunking over the trochanter there. Do you get pain when it does that? No pain. It doesn't feel particularly friendly, right? But it's not painful. Some people it will be painful, or it may be it started off not being painful and it progressed to becoming painful. Where we've got something rubbing on something, we're prone to inflammation, okay? I always liken these sorts of things where we've got tendons or fascial bands rubbing on bone as a bit like in those movies when you've got the rope on the cliff edge, right? And someone's hanging from it, and it's rubbing and it's rubbing and it's fraying and it's fraying. That can be what's happening. We start to get fraying of some of the fibers, which will cause inflammation, and then we start to get pain. What's also a feature in this area is that over this little bone here, the prominence that sticks out on your thigh bone, Between it and that iliotibial band is a little sac of fluid that's called a bursa. You might have heard of bursitis, right? Itis just means inflammation of appendicitis, tonsillitis, bronchitis. Bursitis is inflammation of the bursa. So you've got that little cushion there, and it's there to help that tendon or fascial band glide over them. We've got them wherever tendons are meeting bones to facilitate the motion there. So if you're flicking and clunking like that, you're going to start rubbing on that bursa. When that gets inflamed, you've got trochanteric bursitis. Fancy name for ouch at side of hip. Horrible thing, gives horrible night pain. If you're getting pain at the side of your hip at night, you can't lie on it. You can't lie on the other side because your leg drops down and stretches the tissue over it, and it keeps waking you up. So that's a very typical feature of a bursitis around this hip. So while we don't have pain now, we want to be mindful about what's downstream of these things if we don't address what's going on. So remember that fascia can't be tight in and of itself. It is a thick structure. I used to work with an orthopedic surgeon who specialized in hips of young dancers, and he would say, because in extreme cases, if you've got people who've got a real issue with this, it's really flicking, causing a lot of inflammation, there's actually a surgical procedure where they do a release of it, and they actually create an incision in that fascia to just release it up so it doesn't flick so much anymore. And this surgeon used to laugh when he said people can stretch their IT band. And we'll do a whole video on that. Because he said to cut through that, he needs his sharpest scalpel, and he often goes through a couple of blades. It'll blunt the blade of a scalpel. It's that tough. It's there to hold you up. It stops you from collapsing sideways. Remember, fascia only thickens itself when you load it. So don't keep loading it and then keep trying to beat it into submission with fascia busters and whatever other things you're throwing at your IT band. Figure out why it's doing it. It's not doing it to spite you. You are loading it, and that usually means we've got a little bit of instability in the hip, or we might have an alignment issue. Always go to the why, not the what, okay? The IT band is expressing the what. We need to get to the why. Okay, detective time again. So what can we see here that might lead us down a path of figuring out why this clicking is happening? So I'm going to look all the way down this kinetic chain, all the way down to the foot there. And what do we find down here at our lovely feet level? We have a little overpronation, right? A little rolling. Those feet like to just roll inwards towards the middle of the arch. Yeah, you can lift those arches up. And we see that change there, and then let them drop down, clump. Okay. When we're dropping down like that, it's having a knock-on effect all the way up. And one of the things it tends to do is tighten this outside of the hip. If you were on one leg, let's have you just stand on one leg. Just come a little bit forward so you don't kick the table. There we go. And then just do a single leg knee bend in that position. Okay, yeah, so that knee's a little bit wanting to drift over that way rather than staying over your foot, okay, and come back up. Let's have a look on the other one. Yeah, there's a little bit, woo, bit wavery. So that's indicating that we've got a little bit of control issue going on at the hip. Those overpronating feet are wanting to allow that knee to drop in. What that's then going to do is collapse. I'm exaggerating, but we're going to collapse the hip this way, shorten everything up in this area, and then guess what? There's not enough slack to glide over that bone. So that's going to be something we want to address. We want to look at the alignment there and the control of the pelvis and hips so that we're not repeating the behavior that is leading to that thickening happening and the need for that clunk to happen. Okay, Big part of this would probably be some hands-on work to help release some of those tissues. So it's well worth going and getting a session with a healthcare professional who can get in there and just soften things up for you so you've got a better starting point. But there are some stretches that you can do yourself to help address this. If you watch the stretching series of videos, the hip flexor stretches would be quite good to open up that TFL, because its job is to flex the hip, and we can do our pretzel stretches to stretch the gluteus muscle. So remember, the band itself doesn't stretch, not in the way that we traditionally think of like a muscle does, but so the tension in it is coming from those muscles above. But what we can do is do a little stretch that will address this whole side of the body here, and it's going to involve muscles like your gluteus medius and also the quadratus lumborum muscles in your lower back. If you just turn your back to me and I'll draw that, sorry, back to the camera, not the back to me, I'll draw that muscle for you. So it's a lower back muscle that's coming from your bottom rib in here in a slight diagonal down to the crest of that ilium, that pelvic bone there. And typically when we've got this compression in the side there, we often also have a little bit of cranking going on up in that QL as well. So this is a stretch that's going to get all of those in one hit, which is pretty good. Okay, so we're going to go onto the table for this one. Now, if you're doing this stretch, you really need a solid table surface to do it on, because you want to be quite close to the edge, and if it's a little bit rickety, it could tip over. So ideally, if there's a treatment table available for you, or a Pilates reformer or something you can use, and ideally have somebody there with you who can stabilize the surface for you. You could try it on a bed. Typically they're not high enough off the ground, and also they're a bit squishy, and so you tend to sort of collapse into them and you're not going to really refine the stretch. So you may or may not have a setup that allows for this, but it is a good stretch if you can find one, and you might find that a healthcare provider will do this stretch with you. So we're going to have you perch onto the table here, and you want the hips really quite close to the edge, but you're going to have that knee up on the table so that you've got a stable surface to lie down. And then you're going to lie down in a sort of diagonal alignment. Then we're going to bring this leg just a little bit back. We want to make sure that the hips are stacked one on top of the other, that we're not rolling forwards or backwards here, so that we're really focusing on this area here. We also want to make sure the shoulders are stacked, so we've lined everything up in neutral, then we're getting a really clean stretch here. So in this position, we can just focus on this lateral part of the hip. Are you feeling that in there? Yeah. And that's a good place. You can just hang there, let gravity pull the weight of the leg down towards the ground. If we want to sweeten that up and take it up into this lower back area and into that QL muscle, I'm going to get you to put that hand up and over and meet your other hand over your head that way. You're feeling that now coming higher up into the lower back and into the rib area. So now we're getting this whole complex opened up. I can also do here a little what we call a muscle energy technique on this area. And in this position, I'm going to ask you, just push your leg up into my hand, just with about 10% of your strength. And I'm going to resist that and hold for about 10 seconds, release, and then I can stretch that down a little bit further. That's something that you would have a healthcare provider do with you, but it's a good way to really sort of open up and improve when we've got congestion around there. Okay, bring yourself out of that position. It's a bit of a crank. Another stretch that can be useful if you don't have knee problems. Okay, if you have knee problems, this is not an ideal stretch, but if your knees are relatively comfortable, this is one that, again, just using your own body weight on a floor, you can do this on any sort of floor surface, to get, again, the lateral compartment. It'll also bring it right down more into the front part of the thigh as well. So I'm going to have you sitting side view, And then you're going to have one leg straight, one leg bent, and we want both knees together. Don't go into like your jazz splits position. And you can modify where this foot is depending on the comfort or discomfort of the knee. But if the knee feels uncomfortable there, stop, don't do this one, you can do other things. Now ideally we want both sitting bones on the floor, and you can see he's already avoiding that because of this tension in this area. He's wanting to keep away from it. So you can just let yourself, try not to push it, just let gravity kind of invite it downwards in that position. You can also then drop back to your elbows and lie yourself halfway back. And again, we want to try and keep that knee in contact with the floor and the both hips, or the back of the hips, flat on the floor as well. Is that quite strong for you? Yeah. If you don't feel it there, you can lie all the way flat, but I think this is perfect for you. It's just hitting that sweet spot. We don't want to, remember, we don't stretch our egos, we stretch our bodies. And then as you come out of it, bring yourself up to a sitting position, and then really carefully just take hold of the knee as you unravel yourself from that position, because it does put a bit of a rotation through the knee, and you just don't want to snap out of it because the knee doesn't like it often. But it is an effective way to kind of hit the spot in that lateral compartment. Okay, and then coming back up to standing, to address this control issue that we were looking at of being a little bit wobbly on our descent on a plie, you literally just want to do that as an exercise. Best way to do this is in front of a mirror, because you don't want to be looking down and checking your alignment this way, because you're messing all your body alignment up and you've got your head weight in front of the body. So if you do this in front of a full-length mirror, then you can check your reflection to see where that knee is going. So let's, on this leg, seeing as we've just stretched this one out, if you stand on that one leg, and then try that plie again now. Good, and keeping these hips nicely balanced. Good, much better. Coming back up. A little more kind of stable this time. And one more time. And down. Good, and come back up. So still a little bit of a wobble going on there, but we're not dropping quite so much into it. You can rest the leg down. So doing a nice, slow, sustained plie and up, maybe 3 repetitions on each leg. Give yourself a rest, stretch things out, and then repeat that on a daily basis if you can remember. Really, really protective for our knees, and as well as addressing this lateral snapping hip pattern. The other thing to be mindful of, when we have feet that like to pronate, to drop inwards, don't just correct it by lifting your arches, because it tends to create a lot of tension in the feet, and then you get crampy, and it's not, and you're often sending yourself to your little toe and your 5th metatarsal, and we don't want to be in that position either. So correct your rolling feet from above. And again, go and watch the video on bunions and rolling, and we'll get into more detail of this. But just to put it into context here, if you think of, even though you're in parallel, think of rotating as if you're in ballet first. Yeah. Feel how that rotates, and we've lifted those arches right off now. We've got lovely space here. Then let that go and let it all drop in. Collapse, ba-dum, and the knees go in. Rotate those muscles in first, as if you're in first. Beautiful. So it's done the arch without you having to do it with your feet, right? So always correct from above when you can. Turnout is not about being in ballet class. For most of us, because most of the population tend towards this inward rolling, we all need to turn out even though we're just in parallel. There's a few jigsaw pieces that might lead you to understand a bit more about that lateral snapping hip. Anything that's making noises in the body, it's like the body's going, hello, got a little message for you. Not doing it to spite you, but it's giving you information, and it's telling you, it's whispering right now. It might become a yell louder if you don't address it. So always check in with those whispers and look at these videos and find those jigsaw pieces to address the underlying cause.